Yep. We're gonna get the live stream.
We need to get the public comment portion. For all those waiting with bated breath.
I have looked after meetings and there usually is 2 or 3 people. that watch it. I mean, that's, so there are actual people that we watch it.
And these are recorded and
Yeah.
available, right?
Yeah.
So I mean, this presentation, I bet there's gonna be some interest in this presentation.
Yeah.
There is, it's very interesting. To share it.
Okay. All right, well,
Are we all ready?
yeah, let's do the bit, we'll do our business stuff. We can approve, we have the minutes from May and August. But let's do introductions, I guess.
We can start.
Hi, I'm Sarah Barron. I work at Central Oregon Community College. I teach public health there.
Hi, everyone. Lindsay Ataki, Pacific Source.
Hi, Tom Kuhn, PHAB coordinator.
Rob Ross, St. Charles.
Hi, Colin Sinsky, with Central Oregon Fuse, CBO.
Bill Chang, Shoots County Commissioner, liaison to the Fed.
Brooke Smith, Executive Assistant for Health Services.
Matthew Christensen, epidemiologist, health services.
Then Aaron and Charity.
Hi, everybody. Sorry I couldn't be there. Erin Fitzpatrick with Lapine Community Health Center.
Charity.
Jerry. Are you on?
Well, maybe she stepped away for a
Yeah,
second.
yeah, that's okay. All right.
No, and can you hear me now?
Yes.
Hi, Charity Ludwig, Dentistry 1 PHAB board member.
Welcome. Okay, did anyone have a chance to read the May minutes? I
And
did long time
August,
ago.
May and August.
August, we can approve them together. I wasn't at the August meeting.
Any motions to?
I'm back. I wasn't here in May and August.
I wasn't either.
I sent them out last week. I didn't.
Abstain.
And I haven't read them, so I need to abstain.
No, I wasn't there for, I'll move to, wait, can I do? I'm not,
Sure, why not?
Yeah, I think technically by the bylaws that you can't move.
I can't.
I can move,
Okay,
even though I wasn't there, but I can move. Can I move?
sure.
Okay, I'm moving.
Second,
I motioned.
you were at both meetings.
Yeah,
Colin.
I'll second.
We're not.
Okay. So,
Any opposed? All right.
all right. We're supposed to take any public comments from anyone.
Yep.
On
No one?
video or online, anyone on?
No,
No,
they'd
okay.
have to go to the Zoom to make that comment if they're watching the live stream or come to the meeting. Yeah. All right, moving on, I have a couple items here to cover. My new role, I think I'm gonna wait until our next meeting and cover that again. I talked about it at last meeting, but we had a pretty small turnout in August. So, I'll go into details about that again, but I right now, just to make it brief, I transitioned from my position as a manager in public health to a project manager. So I'll share more details about that next meeting when we have most of the members here and so forth. So anyways, more to come with that one. The PHAB survey that we've been talking about, Colleen and I were able to meet last week and reviewed it. And it's looking pretty good. Rob and Ruth weren't able to make that meeting, so we're gonna try to reconvene with them and then just finalize it, and then we will send that out to the group. And yeah, it's just a survey to find out what PHAB is getting out of the meetings, what they'd like to see more of, commitment to attendance and things of that nature. So that will be coming, and the goal is to have the survey done and the results by the time we have our November retreat. And then that way we can kind of look at what the group is thinking on things. So more to come on that one.
If I could just add,
Yeah.
I think another parallel goal to that is to see what our current member makeup is and where recruitment efforts could focus. But I was also curious if we have a minute or two to hear if there's anything that PHAB members here would want to see on a survey. Or any questions that would be helpful to get data on, like ourselves, or hear from the PHAB members. And I think we've got a pretty good slew of questions on there. Lots of optional questions. So if you don't know anything right now off the cuff, that's totally fine. And you're welcome to weigh in later too. If you do have a burning question you want to hear from other members about.
Okay, thanks, Colleen. Good addition there. I just want to mention at the August meeting, we had a climate and health update by Sarah Worthington, who's our climate and health coordinator. And I just encourage anyone that wasn't able to attend that meeting to check out the presentation that Sarah did. You can go to the Deschutes County Commissioner's website, and there is a taped YouTube version of that. I believe I sent a link to that this past month just to follow up on it, but that's just something I would like the membership to be aware of, because Sarah is very likely in the future to come to PHAB meetings to get some feedback from the group and have you weigh in on the work she's doing. So that's something that would be very helpful for Sarah's work. So want to share that. And one thing that's not on the agenda, but just as far as a membership update, I just wanted to share that Leela Stewart, who is a nurse in town, submitted an application for PHAB membership. And but we always, before we review an application, we always ask that applicants attend a meeting first to introduce themselves to the group and so forth. And then after that, then we'll review the application and interview them. And then also I contacted the new director of Central Oregon Health Council. And
What's her name?
her first name is Ari. I'm sorry, I'm blanking out on her last name.
Powell.
Ari Powell, yes, or Ariane Powell, but she goes by Ari. And she will be attending our October meeting in person, and then she's going to try to decide if either she or another member of Central Oregon Health Council will be our new PHAB representative from Central Oregon Health Council. So we do have a couple member possibilities on the horizon, so. Very cool. Yeah. So anyways, and Dr. Bowen will be rejoining us in January. He asked for a leave. He had something going on this year where he was not able to attend meetings, but said he wanted to remain a member. So anyways, he'll be returning again in the future. So anyways, that covers my announcements and updates. Yes, go ahead.
I meant to email you, but I'm coming off my summer checkout time and I'm back. I wanted to, can I make a couple announcements?
Yeah, go ahead.
And then also get some feedback maybe.
Yeah.
Have you all heard about the Community Health Summit?
Today.
Good. I'll pass this around. I'm gonna take that one away because it has a grease mark on it now. So the Community Health Summit is really focusing on creating integrated approach to traditional health workers, but now we've opened it up to behavioral health also. It's 2 days, and you can check out the agenda by hitting out the QR code. The presenters are pretty locked in, but we still have some openings, hitting on anything from trauma-informed care to integrated healthcare approach to just really looking across the areas, and really hits on continuing education units too. Going to be talking about palliative care, housing, all the different areas. And Oregon Health Authority will be there. Pacific Source is very involved in it. Actually, Pacific Source is sponsoring it. So anything, have you heard about it?
Yeah, Nancy is on my team and
Good.
she's got such a huge passion and heart for traditional health workers. So I have more of that line of sight from,
And
yeah.
And then we're trying to East Cascades work is also involved, and we're really bringing in the behavioral health side of it too. So anyway, that's one thing.
Sarah,
This-
can I-
yes.
Who's the target audience for that? Is it like frontline traditional health
Frontline.
workers or
Traditional health workers, but also clinic. Now too. And the idea is that we don't work in isolation. And so by understanding what each of our roles are and how we can integrate more, that's the big focus of this. So it moved away from the traditional health worker summit to community health summit with the idea of the more we can take down our silos and integrate and work across, the better. And so it's, if you're really into community health, this is your thing, which I think you all are. So I'm pitching it to you. I'm hoping you can come and check it out. There also will be a big networking piece of this too, with tabling. Right now we have about 25 different tables. So if you want a table at the event, that's one thing to check out too. Presenters. And it's only its second year. So to me, it's grown. And I'm really enjoying watching more people get involved in it. So that's one thing. The second thing, and then I'll stop talking, is this, Tom, this is up your alley. You're gonna recognize some people. So, yes, we're trying to create a public, with the American Rescue Plan Fund. There was a real big component of doing really outreaching into the workforce. And one of the big things that's missing is that high schools really don't know about public health. The careers in it, what you can do. And so we're doing 3 classes. And we're also trying to get all this video that we took to really get it down to like 1 5-minute professional polished videos that can be pushed out into the high schools, out into the community about what public health does. And so this is a 1 day with online work beforehand, 1 day, and I am going to be emailing your people and public health people to come present on what public health does. And the target audience, again, are anyone who's interested in US and healthcare, anyone who's interested in public health. And this is going to be offered in Madras, Prineville, and Bend. So I thought it was really super important to put this out here. One, the class is going to happen, so I had to make sure that we had enrollment before I pitched it really hard, and it looks like it's going to happen. 2, now I need to book all the public health people. And I'm also going to get the public health schools to come too. This is how we get our public health workforce, is that we need to get it into the high schools, right? I'm preaching to the choir, right? So I wanted to put this out there. They also get a credit. So you're going to be getting emails from me. Okay, so when you get the email from Sarah Barron asking about this, it ties back to the American Rescue Plan funds, and it ties back to one of the, I think, focuses of this group is really trying to increase public health awareness. So I'm really excited about this, and you all help make this systemic change start to happen, right? Really cool. Last thing, MedStar usually has a very healthcare focus. For the first time this summer, MedCamp, which is like this MedStar, where they had a public health focus. And they actually had the health department out there talking to high school kids. So it's starting to happen.
So you know everyone in already heck.
No, no, I'm not. I don't. And that's one of the things that we need to like. AHEC actually came up to me after presenting to some high school, and they're like, we need to have public health at these outreach events.
Because we're already in the high schools doing this, right?
Yeah,
For
but
health, not for public health,
but not public health. And so what happens is that we don't have high school kids when I go to present and I say epidemiology, they don't know what an epidemiologist is. Environmental health, emergency response, what the health department does, even how the health department's structured. with the commission, you know, the county commissioners, and how OHA, like, none, zero, zippo. So we need to start getting in to be like, hey, this is a career for you. Like, we exist. You want to work with houseless, you know, and policy, you want to work in social work, but then work in public health. This is a real thing. So anyway, high schools, we're getting some momentum, and thank you for letting me take the time.
Yeah, no, actually, I realize there are announcements and updates. There's usually a bullet that says any group announcements.
Okay, good.
So,
I didn't take,
I need to add that to the agenda.
Good, I didn't jump in too hard.
No, that's what this
Okay,
time's
good.
for.
I just want to make sure that I always come back and talk about how American Rescue Plan's funds are being used and how this group can, like, how we can connect more. So anyway, this is big. Thank you.
Related to that, Sarah's been really busy, and I just wanted to make a plug for the newsletter that Sarah sends out, but if you're not already on that list, I don't know how I wound up on it, but it is such an excellent newsletter you put out.
And that's a big Pacific source. And then we also push in a lot of public health stuff too. So it's like, yeah, we're making some traction here. It might not feel like we're always making big system changes, but if you look back, now it's starting to become like, oh, public health.
Yeah.
All
A
right,
lot more than we had,
yeah.
for sure.
All right, thanks, Sarah. So today we have a great presentation and update on changes in Oregon's drug overdose mortality crisis with Dr. Matthew Christensen, PhD, epidemiologist, an example of epidemiology at work. There you go.
There you go.
You can come to the high school.
You could actually. They're like, what is an epidemiologist? I'm like,
That's a pretty common question.
yeah, and you're gonna be invited.
Okay.
You're gonna be talking to some high school students and community college students and probably some college students too.
Go ahead, Nate. Okay, great. Hi, everybody. Well, good to be back. About a year ago, I presented data with the Public Health Advisory Board about drug overdose mortality rates in Oregon. Today, I'm going to update that information with 2 new years of data that we didn't have last year. We're also going to look at several data sources that we didn't look at last year, so that we'll have some information about 2024 up through July, the first half of this year, to get an idea about how things look currently as this year's unfolding. To start, the headline, and you've probably seen this, and this won't be complete news. It's the past 4 years in Oregon, things have changed substantially from 2020, 2021, 2022, 2023, those 4 years, 4 consecutive years, year over year increases in drug overdose mortality. Large increases. It isn't just Oregon. Much of the West Coast has followed this same pattern in the past 4 years. There's been a national shift. Prior to 2020, it was happening in other parts of the country, East Coast, South, and then 2020, it has shifted. There's been decreases in some of those other states, east of the Rockies, but out here in the West, everything has been going up the last 4 years. I'm going to go through several slides where we're looking at a national perspective, a state perspective, Oregon, and then also Deschutes. So we'll bring in the national, the state, a local perspective about this. Last year was Oregon's worst year, you could say. We saw our single largest increase, single year increase in drug overdose deaths in our drug overdose rate. 2023 was a bad year. We've had 4 consecutive really surprising years. It is from my job to see something like this. You don't see this in a population. And it isn't just Oregon, it's the West Coast, but there's been dramatic changes when we're looking at drug overdose mortality and then knowing all of the things that associate with that aren't necessarily leading to death. But we're looking specifically right now at mortality rates and changes in mortality rates. Deschutes County has seen increases in the last 4 years, but we went from having some of the lowest rates in the state back in 2019 to, we still have some of the lowest rates now in 2023, but our numbers, our rates have also doubled in this time. So we'll look at that data as well. As a state, during this 4-year period, Oregon went from one of the lowest states in the nation to one of the highest states in the nation. And I'll show you exactly what that looks like. Let me see if I can I minimize
That little,
Yeah, up to
that
the.
little,
this guy?
that guy, yeah.
Awesome. Okay.
Um,
So 2.5 decades, the last 24 years, going back to 2000 up through 2023, the green line is the United States. These are drug overdose mortality rates per 100,000. And the blue line is the state of Oregon. So our focus today is these 4 years from 2020 through 2023. That shows you what has happened in the past 4 years in terms of our number of deaths. I want to look at this with you. This is from 2006, actually 2006 up through 2018. That's a pretty flat line, a long period of time in Oregon. We're right around 10 drug overdose deaths for a long period of time. That's what we were used to. It was increasing across the country. Wasn't really increasing here, the West Coast or in the Western states. And then 2020 started to increase a little in 2019, but really it was 2020, 21, 22, and now into 23, where Washington is much higher, Alaska is much higher, Oregon's much higher, even California, biggest state in the nation, has seen their rates double as well. In 2023, our rate is right at 40 deaths per 100,000. The US in the last 3 years has pretty much stabilized, and we're right at 100,000 deaths, drug overdose deaths. These are unintentional, determined to be accidents. These aren't, we're not looking at intentional or suicide deaths with these data. Everything we're going to be looking at today are unintentional drug overdose death data. And so the national picture the last 3 years is right around a rate of 30. And you can see in 2023, or that was really the first year that Oregon went well above the national rate. This is a picture of the state of Oregon in 2023, showing our 36 counties. So that's supposed to be tan to brown. It doesn't look tan to brown to me. So go from light to dark. So that's part of it too. The tan colors. Oh boy, it's kind of hard to distinguish. The tan from the. So I'll just circle what we've got going on here. Our color code is it's a light tan color. So Umatilla is that color. These 4 counties are tan. This eastern half of the state though, that there was fewer than 10 deaths in those counties. We didn't calculate rates, so we actually don't have any colors in half of the state, but the majority of drug overdose deaths have happened on the western half of Oregon, where more than 90% of the population resides, 90% of the drug overdose deaths occurred. We're going to be looking in a minute at this sequence of 4 years for 2023, 2022, 21, and then 2020. And this map will give you just a feel for how things have changed, where they've changed. Right now, I want to just focus on 5 counties. Oh, wow. Yeah, awesome. I'm going to show this to you if you can see it. That's what it's supposed to look like. There's my brown counties.
Oh,
Yes.
oh, yeah.
Harder to distinguish up on the screen. It just isn't coming across.
Yeah.
Right now, I want to just point out 5 counties. We have 5 counties in 2023 with rates, drug overdose mortality rates above 50. Oh, Oh, the lights are, yeah, okay, hey, that helps, that does help. Is that okay with a little bit darker? In 2023, we have 5 counties, so Multnomah had a rate of 77, it was the highest in the state in 2023. Lane County, I believe that's 52. Jackson, down here, these 3 counties on the southwest corner, the border with California, 55 in Jackson, Josephine 51, Curry 51. And so I want to talk about those 5 counties for a couple of slides because rates above 50 in 2023 is above the national 95 percentile. We have about 3,200 counties in the US, over 3,000 counties. We have 5 counties that are in that top 5% of drug overdose rates now in 2023. It hasn't been like this before. 2023, we continue to increase while other parts of the nation haven't so much. So let's start with Multnomah County. We are looking at our large cities in the US here. So these are the top 5 cities with the highest drug overdose mortality rates. They are still county data, but this is where the cities reside, what counties they reside in. The 5th highest drug overdose mortality rate with cities. This slide was restricted to 500,000. So only cities with 500,000 or more. So these are our large cities in the US. We're excluding smaller cities, 500,000 resident population or greater. The 5th highest and 5th and 4th both had rates of 74 drug overdose deaths per 100,000. Remember, the national rate right now in 2023 is 30. So Nashville and Philadelphia are at 74. San Francisco, California is 75. Multnomah County, 77, the 2nd highest in the nation in drug overdose mortality rate. And then Baltimore City jumps off the chart. I do want to mention a little bit around Baltimore City, though. They're a little bit different government structure. I don't know if that has a play in this data, why they look so different. It might have a little bit, but the city of Baltimore has their own government, and then you have the county of Baltimore that surrounds the city, and they're 2 separate entities. And so in the data, the national data, they represent 2 different things. You can look at Baltimore County, which surrounds it, more of a suburban, and then the city. And so that doesn't apply to the other 3 counties we're looking at. Portland is in Multnomah. Philadelphia is in Philadelphia County. Nashville is in Davidson County. So it's a little bit different. That might be why it's a little higher. We might be excluding some of the neighborhood suburbs a little bit with that Baltimore. I'm not sure, but that's a large difference between Baltimore. But so there's your top 5 largest cities in terms of drug overdose mortality rates. Portland has not been in this group before prior to 2023. And these are our 5 counties with in that top above the 95th percentile in the nation. Multnomah County, Lane County, Jackson, Josephine, and Curry. I want to talk about Jackson just a little bit. We sometimes compare ourselves in Deschutes County to Jackson County. Their resident population is around 220,000. Our resident population is just under 210,000, so we're similar size. This is Medford, and the surrounding population lives in Jackson. Here with Bend and Deschutes County, similar size. Very different experience in the past 4 years. We had a rate of 12 in Deschutes County last year. We had 24 drug overdose deaths. Jackson County had 122 drug overdose deaths. That's 5 times higher than us last year. Very different experience. And that's a lot of the story about the past 4 years. When we look at the maps so that we're gonna go through here in a minute, 23, 22, 21, you can see where things really changed dramatically, and there is spread a lot through a lot of the western counties, but boy, not evenly by any means. Some counties are shouldering much more of the drug use, drug addiction, drug overdose mortality. This slide is where I make the statement, we've gone from one of the lowest to one of the highest. So in 2019, you can maybe see the numbers here. Wow. Yeah, I can't see those numbers, but I'll say what they are and I'll circle one with my cursor. So that's 22 in 2019. Oregon was at the 22nd percentile in terms of the national. Where did we rank in the nation? Our drug overdose mortality rate. We're in the bottom quartile. We were some of the lowest. We were among the lowest states in 2019. 2020, we increased to 24. So we're still in that bottom 25% of the country with the lowest rates. And then we increased to 31 in 2021, 49. We're right at the 50th percentile, right in the middle in 2022. And then 2023, we crossed up into the top 25%. So between 2020 and 2023, it was a complete flip. 76 to 24, 24 to 76 as a state. That was large part that the West Coast just increased dramatically, but other parts of the country, not entirely, we'll look at on the next slide. Some other parts of the country did see a little bit of a decrease. Here is our 51 states in the country, including the Washington, D.C. On the far right, we have West Virginia. In 2023, with the highest rate in the nation, West Virginia has always been either the top or in the top 2 or 3 year in and year out for many years now. Washington, D.C. with that second highest rate. This is us in Oregon with a rate of 40 deaths per 100,000, right around 3/4 of the way up this profile. 30 is the national rate in 2023. That represents New Hampshire. And then this is Nebraska down at the low end with the rate of 8 deaths per 100,000. Washington is above us here in Oregon. They're in the high 40s, I believe. Alaska has the 5th highest. All three of Oregon, Washington, Alaska have done this low to high in the past 4 years. California has not quite as much, but their rates have doubled. They went from down here 4 or 5 years ago to up here. But California is like having 4 or 5 states, separate states anyway, in terms of population. Certainly there are parts of the state that have increased and other parts that haven't. All right, so now we're going to just walk through these 4 maps from 2023 back to 2022. The darker colors do represent higher rates. I want to just take a minute and walk through this with you. We do have 5 colors. This is supposed to be a tan, and then it gets increasingly darker. The lowest rates are 12 to 19. And then the next category, 20 to 29, 30 to 39, 40 to 49, and then above 50. These are the statewide rates. And so you can look at county-specific rates and kind of compare it to the change year in during this 5-year period to the statewide rate. But we're just going to click through and for the moment and get a feel. At this, in 2020, there was only 1 county above 50, and it was Multnomah at 51. In 2021, Curry had a high rate of 89, but no other county crossed the 50 mark in 2021. And then in 2020, things look very different. All of the counties were in these bottom 2 categories under 29. Nobody got into the 30 point. So there's just a couple of points that I want to make before we move on from these maps. This is 2023 again. So to describe what has happened, we've got 4 or 5 areas that are continually the highest in the state, and they have been for several years. And it is these highest ones here in 2023, Multnomah County, Lane County, and that entire southwest corner have year in and year out have the highest rates in our state. And so that's really where the burden of drug overdose has been. Deschutes County We're now in 2023, our rate is 12, and things have increased here, but by comparison, we've really haven't experienced what several of our neighbor counties and neighbor communities have experienced during this time. Besides those specific locations that are always the hotspot areas, there's been a lot of spread in these western counties, all through the West Coast. This in 2023, there's no other map that has looked like this. All of the coastline counties have pretty high rates, and that hasn't been the case up and down the entire coast. Tillamook, Lincoln, Clatsop has gone up and down a little bit. Coos has gone up and down, but now the entire coast has high rates. They're in the 40s, the high 30s. So the idea of spreading out has certainly been happening in 2023 in the last few years as well.
You probably don't have this map, but gosh, I would love to see if it's clustered in those counties, like if they're clusters.
Within the county?
Yeah, I'd really like.
If you want to look, I would suggest Multnomah County. Just this year, they went live with their county, and they are presenting census tract data inside Multnomah County with numbers of drug overdose deaths, emergency department calls, 911 calls. So you can look within Multnomah County where things are happening, and it clearly shows where the numbers are high.
Yeah,
It's great.
Targeted outreach.
Yeah, they.
I mean, you know, the other thing is like Lane County, that's like over 3,000 square miles.
Yeah.
And, you know, I'm sure it's concentrated in Eugene and a couple of the coastal areas.
Yeah.
So I mean, I can guarantee you that it's concentrated, like, you know, it's not like there's vast rural federal land areas where you know, there's no population, so you're not gonna have
Right.
overdose deaths. So
Yeah.
I'm sure it's concentrated, but still, like, you know, concentrating on the city of Eugene is still it's a pretty big,
Right.
it's a pretty big job.
And then you start thinking about like the networks that people have and how you start to kind of intervene with those networks, or even like Tillamook or Lincoln. That whole west, we were kind of the I-5, you mentioned the I-5 corridor,
Yeah.
but then you look at, you know.
It's like there's a highway 101.
Yeah, what's going on? Yeah. Anyway, thank you. Interesting.
This is a little bit of a look at the drugs. I put this slide together, and I knew that we look different from the US. I didn't realize it was quite this different. So we're gonna look at drugs that were identified in the toxicology results after the drug overdose deaths and how that has changed over the past 4 years in Oregon and also in the United States. Oregon on the left-hand side, United States on the right. We're looking at fentanyl, methamphetamine, cocaine, and then the red line is both fentanyl and methamphetamine. I'll explain that when we get to it. So let's start with fentanyl. The green line in Oregon in 2018, 2019, about 20% of drug overdose deaths were positive for fentanyl. And then this happened in those 4 years, 2020 up to 2023. If there's one thing that's changed in the past 4 years, the most strongly associated with our increasing drug overdose deaths, that's certainly it.
With
And it's
meth,
consistent with what we've known and seen across the country. Go ahead.
the meth too. I thought a law enforcement told me that they're lacing fentanyl with meth.
Yeah, that's the red line. Yeah.
Oh, there's a red line.
Yeah, I'll show you, I'll explain, but yeah, that's the idea of the red line is the other 3 lines for fentanyl alone, meth alone, cocaine alone is just looking for, was that drug identified in the toxicology results after that? And so it's not looking at or not concerned about what other drugs were involved. I included the red line because that is a new feature that hasn't been part of what's happening across the country. It's really happening here in Oregon and the West Coast, where now in the last 4 years, meth and fentanyl are coming back much more commonly. So in Oregon, in 2023, nearly half of our deaths, 47%, came back positive for both fentanyl and methamphetamine. Whether the individual knew they were mixed or not, that's the drug supply is now largely those two drugs are coming together.
So those percentages, that's not supposed to add up to.
No, these are not 100, right? That's good point. No, we're not. So that's why each drug we're just looking, was it present? And so in the drugs. And so the idea here, the overall picture when we're looking at drugs is it's very seldom one drug. It's often 2, 3, 4, sometimes more than 10 drugs are identified. Alcohol, prescription opioids, heroin, other kinds of drugs that were used, but the driving mortality risk related drugs that we focused in on and that are clearly associated with mortality risk are fentanyl and methamphetamine. On the West Coast, we'll look at the yellow line though. In the US, cocaine is a significant contributing factor, and that's less so here in Oregon.
Do they have any statistics on benzos?
Yes, yeah, benzos come up often. Yep, in a previous job, I reviewed the toxicology test results and the medical examiner reports, and so I would look at the individual, and so yeah, benzos came up.
And they're just not on the chart because they're not significant, or because?
Because it would be way too complicated. There could be a presentation just about toxicology results that could break down
there's
the combination.
THC and benzo.
Oh, yeah,
and everything mixed in.
Everything is mixed in, right? It's a more complicated picture. We are focusing on the 3 most lethal drugs associated with mortality risk, in terms of driving what we're seeing with mortality. You take away these drugs, the deaths would drop dramatically. If all the other drugs continued, I mean, there would still be some. Okay, so this is fentanyl for us here in Oregon, and this is fentanyl in the US. So in 2018, half of the deaths in the US were coming back positive for fentanyl, and it had not really arrived here in these earlier years or in smaller, less access. And then it has increased nationally as well, up to 74% of drug overdose deaths. The blue line represents methamphetamine, and that is more common, more frequent. That's what we have recognized. Prior to 2020, we were focused on methamphetamine in Oregon in terms of this is our main problem. This is what we're seeing in the data. And that's the case in a lot of the Western states. We had 52% of our drug overdose deaths that came back positive for methamphetamine in 2018, and that increased up to 67% in 2023. The national picture, though, that's not necessarily the case. They're at 25, that increased up to 38. This yellow line is cocaine nationally, and it's right around 25 to 30% higher than what we're seeing in Oregon. And so that's one of the differences between those two stimulants. Cocaine is just less available here. It's coming up less in our toxicology results with these drug overdose deaths. The red line, we've talked about a little bit. I included it because this is a new feature where fentanyl and meth together are being identified in the same individual. That was not the case. That is a new thing in the past 3 to 4 years, and it's really become very common. This is mostly a West Coast thing because there's been this national shift. Prior to 2020, a lot of the increasing and the spikes in the country, East Coast, in the South, the Midwest, and then in 2020, it's really been a focus on the West increasing. The whole West 4 states that we've been talking about. And then during that time, this is where we're now seeing meth and fentanyl increasingly identified in the same individual, where in our state, nearly half of our drug overdose deaths came back positive for both of those drugs.
So, yeah. I mean, the red line is in some ways reflecting the blue and the green lines.
It is, there is overlap. Yeah, we don't want to add up. This doesn't add up to 100%.
You can't have 77% of the deaths.
No,
with
yeah.
fentanyl and 67 with meth without some.
You're right, yeah, I'm breaking a rule, a graph, one of the graphing rules. And so in understanding this graph, looking at percent, this is not a graph that you want to add up and say 100%. It's the idea is a simple, was the drug identified? And then when we're looking at the red line, were those two identified? And there is a lot of overlap, yeah, and differences. And so, yeah, the drugs is just a very complicated picture. And so we're just trying to identify how frequently was fentanyl used, how frequently was meth used, how frequently were they used together? So the individual knew they were being used together or not. Yeah.
Do you know if there've been corresponding changes in the rates associated with like alcohol related deaths or benzos or other ones not listed here? Like if there's some kind of like replacement usage?
Yeah. I don't have that slide today, but you can look at changes and prescription opioids more broadly, not just benzos. I haven't seen anything specific to benzos. They've decreased during this time. Yeah, for the state of Oregon, those data are available. And so when you go back to 2019, heroin was more a part of the picture. Fentanyl was a less part of the picture. Prescription opioids were a piece of the picture. Yeah, this is not that long ago. And prior to 2019, it was a lot around prescription opioids, heroin, and then fentanyl that was coming on the scene. At this point, things have just really changed. Prescription opioids and prescription medications are decreased. They're still 10%-ish or less in terms of being identified. Same with heroin. It's now meth, fentanyl, and there are still other combinations. Alcohol is sometimes part of the picture. I am happy to present this slide in the next few slides because I've been giving this presentation for a while now and I have not had good news. But I have some good news. And it really is good news. And so it's exciting for me to be able to share this side because there appears to be some changes, very meaningful changes. We're going to switch our data sources. We've been looking at mortality data, which comes from the death certificate, vital records data, from national data, vital records, state and local. All use the death certificate, very good surveillance system. We're now switching over to emergency department data, different system. We're not looking at mortality. These people have survived the drug overdose. We're going to look at opioid overdoses on the next slide. And there's been a decrease in the past few months and also here in Central Oregon. So this is the slide that I saw this about a month ago when I was looking at the ED data. I thought that just wanted to see what the pattern was. And I saw this peak. And that says 646. That's August of last year, a year ago. From right now, this is the time frame we've been looking at with mortality data, the last 4 years. So in January 2020, there were 293 opioid overdose emergency department visits in the state of Oregon. January of 2021, 308 opioid overdose ED visits. January of 2022, 329 in Oregon. January of 2023, 490 opioid overdoses. August, 646, a very clear peak. This underlies 2023 in our state. No other year, and just in the ED visits, look at that increase in ED visits. None of these other years have that same trajectory. And then the peak stopped, it turned. And now in July of this year, a month ago, 339 opioid overdoses in Oregon. This is a very clear positive signal. What it suggests to me is there might be a change in the fentanyl access, fentanyl distribution. This morning I was going through this presentation. And I got a thought, let's look at the ED data for, the mortality data for Oregon and see if we can pull out the monthly data for 2023. We don't have 2024 data yet. We won't get that until next year. So we won't know mortality for this year till we get into next year. But we can look at through 2023. And I thought, what do those numbers look like after August? So I pulled them for Oregon, and it was too much up and down. It appears they might be decreasing, but it was just too much up and down. And then 30 minutes before this presentation, I thought, well, let's look national. Here's the national data on the same thing. And there is something happening. This is last year, 2023. These are 9,000 drug overdose deaths in the nation every month. And so we're hovering right around 9,000, and we get to August, 8,768, that's 1,000 decrease in September. And then it goes down a little bit where it's 7,451 in December. It correlates with what we saw in our ED data, that something happened after August. So good news at this point. Exciting to see something like this. Yeah.
Do we know anything about Narcan availability and if that's helped keep people out of EDs?
Oh, yeah, Narcan is proven.
As far as maybe a shift in policy around that time last year?
Narcan, I'm not sure exactly what you're asking. I don't know of any shift in policy. I don't think Narcan would be associated with this. This is a national and a statewide trend. That would be have to be a big change in the distribution and effectiveness and outreach related to Narcan. And I think this is a little bit bigger than that. And Narcan has been available for many years. And emphasized for many years here in Deschutes County and throughout Oregon and the United States. So I don't think that changed yet. Go ahead.
I was gonna ask the same, but can I make sure I'm understanding this right, that the opioid ED visits have decreased in Oregon starting in August? And that showing the next slide about the national data answers my question about like, well, did those just turn from ED visits into fatalities that never made it to the ED? But it sounds like both fatalities and ED visits are decreasing.
They're both decreasing. Yeah, it's August is the point in our state ED data. August is the point in the national mortality data.
We don't have the state level. You said that's too variable to look at.
I looked at the state mortality data and the numbers look a little lower. One of the months in these last 4 months was high. And so I just like, you can't really make a conclusion. That's what got me thinking, well, let's look national. And so I looked national. I put this slide together just not long ago, this national one. And that's substantial because I look back the last 3 years, the national rate is stable. The last 3 years, it's just over 100,000 deaths across the United States. And the rate is 31, 31, and 30 in 2023. I'm seeing now the reason that the rate is a little lower in 2023 is because of those last 4 months. If it would have stayed like the rest of the year up to August, right around 9,000 on that trajectory, 2023 would have been the highest year in the US. But something changed in those last 4 months.
I am just very anecdotally, Best Care, working here locally in Central Oregon, they've said that a lot, there was a huge number of overdose deaths in their clientele in 2023, and there's been many less this year.
Yeah, that would correlate with our ED visits. We're seeing our ED visits have been cut in half in a year's time from what it was in August. That number is down to almost half of what it was. So, so this is
46 to.
This is the Oregon statewide. I did look at Central Oregon ED visits, and the decline is not quite as steep, but it did peak in the third quarter of 23, and since then the line is coming down. Yeah, it's not quite this dramatic. Yeah.
This might be your next slide, so maybe.
Yeah.
But I'm curious to hear your thoughts on why.
I think it's something happened with fentanyl access. So I've seen just in the news, I can relate in the news, they're trying to affect China, the source material. This is specific to fentanyl. This is only opioid we're talking about in terms of these ED visits and also impacting the deaths. There might be something happening with the change in the source chemicals coming from China, New Mexico. And so if they're seeing less of the materials to make fentanyl, then maybe that could be, then that would explain this, because these are big, you know, from a national perspective, something is happening to change this. So this gap right here, if the line would have continued straight out, is around 500 deaths or 500 lives, 500 people that did, or excuse me, 5,000 people that didn't die in those last 4 months. Since this has changed.
I think Narcan, just even when they released it and they pushed it out and made it free, it must have made some impact.
And not just Narcan, but I mean, there's this whole suite of harm reduction strategies that have really.
Yeah, because they pushed it out.
In the last couple.
Administration pushed out, and I watched more and more people get access to it over the past year. I've even heard of stories of people using it, you know, anecdotally, but I'd love to give some of that, you know, that tertiary prevention. I mean,
I mean, there's all a bunch of stuff. This whole suite of harm reduction stuff, I mean.
Yeah, I'd like to think, because, you know, the DEA and their ability to enforcement and to reduce the chemicals coming in, but think about like the harm reduction. I'd like us to, I'm really curious. I'm gonna start researching that. I'm curious now to see that.
Good, Matt, you were talking about the kind of interruption in the supply of fentanyl and fentanyl materials. I mean, do you have data to?
No, I don't have data.
describe that? I mean.
No, I don't. Yeah.
I want that too.
So, next week I am giving a presentation to Pacific Source, and along with, his hat's in the ring for the sheriff. He's gonna be speaking as well. Yes, Ken is gonna be speaking on the law enforcement data. So I'm interested to see if the law enforcement data, the arrest data, because they have a statewide data system where they are tracking their data as well with fentanyl pills and the amounts of fentanyl, the number of arrests, if they're seeing a change in that. So I'm interested to see what he has to say.
Feel free to tell me to hold my questions till the end if you're gonna answer
Oh, go
this.
ahead.
I'm really curious about what other factors or trends are correlated with this data. And if you know of anything as far as like rates of poverty or homelessness or Measure 110 or any of those other factors, if it's possible to draw a correlation between them?
Not at this point, no. Right now, at this point, it's all speculation. And so the idea is between both data sets, we can see August was a high point and things have changed after August. National mortality data has that. Statewide in Oregon, ED2 separate surveillance systems saying the same thing. After August, opioid related, fentanyl related are decreasing.
So the cost of rent has followed the exact same trend. It peaked in August 2023 and has decreased both in Oregon and nationally.
Well, there's a correlation.
Obviously, my homelessness hat.
I mean, the money for treatment from Measure 110 was also just really starting to kick in
Yes.
last summer. I
Yes.
mean, you know, it took so long to roll out the funds for the treatment resources.
It's
And,
like-
you know, now it's finally, you know.
I
That means that we want to fund a big research project to answer all of our
Yes,
questions.
I encourage you
No,
to.
we need a PhD
If you're
student.
interested.
Well, and they just rolled back some of the regulations for 110 on Sunday too. So now that there's going to be a little bit more enforcement for
Right.
having possession. So it'll be
I mean-
interesting to compare this data again next year.
Yeah, but this is, I mean, it's been this is a year's worth of data, positive data, and they just repealed Measure 110
Yeah,
decriminalization yesterday. So it's
yeah,
just-
that's gonna be an important blip in the graph.
Yeah.
Well, yeah, this would require a huge multivariate analysis. and a Cray supercomputer to do anything with it.
Yeah, yeah,
So-
we're trying to predict what we're gonna know in a year. So a year from now, these things will be in the headlines and they will be able to answer and say, wow, things did decrease this much. This is what we think has changed. So, yeah, we don't, I mean.
So I've got a question though about the rates of HIV and hepatitis C. Have they followed this or do you know?
Oh, that's a good point. Yeah, substance use. I don't know off the top of my head. Yeah, we do have a epidemiologist here in the county that does work on that. He could answer that, but I don't know.
Yeah, just because some of us back in the early aughts predicted that this, you know, the huge crackdown on prescription opioids, which tend to be safer, was going to result in a transfer of many people to street drugs and a concomitant increase in infectious disease, which would potentially result in a public health crisis of another sort.
Right.
So I can say that I've seen the data that Jesse has presented in the last few years, and syphilis has increased in Central
Yes.
Oregon and across not just Central Oregon, but across the state of Oregon. So those rates have increased, and I did remember I asked her a question about why are they increasing, and she said, oh, I think there's correlation with increased substance use, and that's part of the picture. So yeah, that's part of it.
Be interesting to see that.
Okay, so on this same path, I had the thought of, well, what about methamphetamine? So I looked at methamphetamine for our ED visits. We're not seeing an increase in our ED related stimulant and methamphetamine visits. So here are the number of monthly emergency department visits in the state of Oregon. There was a peak in 2021, decreased a little bit, and then it stabilized to where we're around 1,200 ED visits related to methamphetamine and stimulants in the state of Oregon. And so we aren't seeing any real change in this last year. It's specific to opioid, which is going to be fentanyl, you know, in this case. And I'm really excited to share these next two slides with you because this is not Deschutes County data. This is City of Bend. This is a partnership that began back with COVID, where we started collecting wastewater data to monitor COVID in Bend and around Bend. And about 8 months ago, we added fentanyl and methamphetamine to be tested in our wastewater data specific to Bend. And so we're looking at fentanyl. The blue line represents a national rate for fentanyl in wastewater. And this is Bend. So we are lower than the nation, which is consistent with what we know from our mortality data. We have low rates here. And in the past 8 months, our prevalence of fentanyl in our wastewater is decreasing. So actually a third data source, separate data source, that's showing decreases related to fentanyl.
That's powerful.
Yeah, yeah.
There you go.
Local Bend data, awesome. I haven't shared this before, so.
That's really cool.
Yeah.
If some of the fentanyl use is happening in unauthorized encampments.
Not catch rate, yeah, this
They're
is,
not putting anything into the wastewater.
No.
You're saying they're peeing in the trees.
this is City of Bend water reclamation. So yeah, there are definitely limitations. This is city, Bend city stuff. But still, this is very encouraging given what we've seen with those other two data sources in terms of fentanyl decreasing. So we're seeing that same trend here as well. And for meth with our wastewater in Bend, higher than the national. So this represents the national rate for methamphetamine in wastewater. And like we've talked about before, meth, we have a longer history here, higher rates here. In Bend, we have higher rates of meth in our wastewater, and we're not seeing a decrease in these data. So some nice consistency across multiple data sources when we're looking at meth and fentanyl, suggesting that fentanyl is decreasing in recently, but we're not really seeing changes in the meth use. I put together this slide to answer a question specifically, and the question was, did Deschutes County look similar to the state regarding fentanyl and methamphetamine? And it does. So I'll just quickly roll through this. Over this 3-year period, 2021 to 2023, 66% of drug overdose deaths in Deschutes County were positive for fentanyl. Similar to the state of Oregon, 67% during the last 3 years. 63% of our deaths in Deschutes County came back positive for methamphetamine, similar to Oregon. And then you can see nationally that meth is just less of the picture.
So even though our rates of deaths are lower, the mix of drugs involved is comparable to the state.
Yes, yeah, right. It suggests that we are part of the Oregon supply and part of the Oregon picture. And so our mortality drugs are looking similar to Oregon's mortality drugs. Yeah, I just wanted to kind of confirm. I expected it to be that way, but I thought, let's go beyond just what we expect and suppose let's actually check it. And so it does. Our numbers look very similar to the Oregon picture. So as an epidemiologist, I wanted to put this slide up, and I presented it last year as well. This is from a prevention perspective. So what are we doing? So standing at 20,000 feet, big picture, a lot could be said about what's happening on both sides of this slide. But from a 20,000 foot level, this is about trying to impact supply and demand. Impact drug supply, impact drug demand. And so largely law enforcement agencies, international, national, federal, state, and local law enforcement agencies are working to impact the supply side of the drugs. We have a lot going on both sides. On the right-hand side, we're looking at the demand, trying to reduce demand, treatment services, harm reduction services, Narcan, a lot of different efforts going on both sides of these, 1 and 2. But from that 20,000 foot level, I like to at least present this conceptually to address what's happening, what are we doing, and then you can go down from here in terms of specific questions, specific programs, specific strategies. In conclusion, Deschutes County, we have seen increases here in Deschutes County. Our rate has doubled from 6 to 12. We went from the lowest and we're still at the lowest, but things have increased here. These drugs are here, but in comparison to what's happened in several other communities in Oregon, we have not experienced what several other communities have experienced in Portland and Multnomah and Medford and over in Eugene. Been very different, 5 times higher in some cases and even more so. We had 5 counties in the top 5% in 2023. That's a first for Oregon relative to the national picture. And then we just talked about the ED data. Very positive, and other data sources that are suggesting opiate-related, fentanyl-related ED visits and deaths are starting to decrease just recently. If this trend continues, I started this presentation saying we've had 4 consecutive years, year-over-year increases, higher, higher, higher. If this trend continues, we probably won't see a 5th consecutive year in Oregon of higher, higher, higher. I don't know if it's going to level out, if it's going to decrease a little bit. It's not going away. I certainly don't want to suggest that it's over or going away. But this idea of, wow, when is this spike going to stop? Maybe it's stopping in 2024. So, I pulled multiple data sources. If you have an interest in any of that, I want to just quickly recognize many other individuals and groups that are working in this area. The Central Oregon Overdose Prevention Response Coalition. This is a group that meets every couple of months. Representatives across all 3 counties in Central Oregon talking about this. In our health services department here in Deschutes County, we have several program staff and great support from our leaders in the county around trying to address and reduce risk. And certainly some of the success here in Central Oregon, you can look at both success from a law enforcement perspective, but also from Narcan, harm reduction, what we're doing in public health, health services, our treatment programs. I think there is some to go around there. And then lastly, we've had a great partnership. It's a new partnership with our Deschutes County Medical Examiner and the staff that go out to the scenes of these drug overdose deaths, collect the evidence, conduct the interviews. They've been sharing data with us for 2024, so we know where we sit now. Prior to gaining access to our local mortality data, drug overdose death data, we wouldn't know what happened in Deschutes County for a year and a half later. We would find out next year what happened. So I can report to you right now, in Deschutes County, there have been 23 drug overdose deaths so far in 2024. All of last year, there were 24. So right now we're at 23. The previous year was 26. This year might be our highest, depending on what happens in the last 4 months here in 2024. But that's where we stand. We're really monitoring and concerned with the idea of knowing that several other communities have just seen things jump up in a short period of time. That's really been our focus, is if it comes here, things really start to increase, we want to be able to identify it quick enough to where we can try and reduce risk when it's starting to ramp up. And so, but we haven't seen it, thank goodness. We're kind of in the same pattern we've been for several years with around 20 drug overdose deaths. Thanks for inviting me, and that's all I have.
Yeah, sorry. That switch to the, more real-time sharing of data, what drove that? I mean, was that just asking or? Yeah, well, there was a recognition. A couple of years ago, we just started having the conversation around what we knew, and one of the weaknesses that we identified really quickly was mortality data. We don't know what's happening in the county until the state data become available, and that's 18 months after the fact. We would learn about 2023 next year, and so the reason we have access to it now, CDC is actually reporting it more timely than they used to. But so it was that recognition that there was this long delay. We didn't know what was happening in our own community. The source of that information across the country is whenever there is a death, medical examiners, there's a team that goes and they have to conduct their investigation, collect their evidence, complete the death certificate. That starts this long process of completing vital records. And so I have worked in another state where we had timely access, so let's go ask, let's bring them on as a partner. And they were very supportive. They said, yeah, sure, we'll do it. So they have.
Related to the medical examiner data, I know that starting in 2021, they were required to report on the death certificate if individuals were homeless. I'm wondering if it's possible from that to parse out which of these deaths were.
Yes, absolutely. If it's on the death certificate, you can parse. There's a lot of parsing you can do, and that's a really good surveillance system. Yeah, now that that's collected on the death, you can do exactly what you're thinking. Absolutely.
Is that a request?
Would that be a request? I know that Multnomah County's pulled that information because they've been tracking for longer than it's required.
So let me tell you where I get my data. I get it from the national website, national CDC.
Okay.
So it's a little frustrating for me, but so we go from local, we're completing the death certificate, goes to the state completes it for the state of Oregon, and they report it to the CDC. So that's part of the funding stream. There's funding for that, and there's requirements as to you have to collect this information, complete vital records, and then you report it. And then once it gets to the CDC, they have sent very stringent, and they're increasingly, and that's been great, where they themselves are saying, we need to turn this data around as quick as possible. They're starting to report provisional data. And so that's how I know we're talking about 2023 mortality data today. It's not final yet, but it's 99% final. It'll get final in December of this year. It's not going to change much. If it changes, it's just going to 3, 4, 5 cases might change. So
you're still pulling that 23 number you gave us, that's coming from the CDC.
No, that's not. Yeah, that's a good point. No, the local data. So I don't have access to the death certificate. We've requested 30 indicators that they collect on the death certificate, and that's what they report on. Every time there's a drug overdose in Deschutes County, we get an output of these indicators as to where, what was collected, what did they find, why did they think it was a drug overdose, and they give us all that information. We aren't asking about. No, we do. We do. One of those indicators is it's 3 things. We do it. I could look at that. Yeah, no, it's, we split it up into 3. Was it a permanent residence? Was the deceased found at their permanent residence? Were they found at kind of a transition, either a shelter, a hotel, or were they found on the street in a car or in a tent? So there's 3 levels to that homeless. So yeah, we do collect it. We have data for 2024. I couldn't get it otherwise though for Oregon or for Deschutes County prior to 2024. So I couldn't do, but you know, it can be done.
It would just be super interesting to know within those 23 that you're aware of in this year so far. You know, the housing status.
Yeah.
Or the location, basically.
Okay, I'll give you an impression because our harm reduction is on our team, and harm reduction works with our homeless population largely. And they've had this question, they've really been focused on it. And they were anticipating early in 2024 that a large chunk of the deaths were going to be homeless, and they were surprised. And we had a conversation, a meeting a couple months ago. It's not really the homeless, and that's some of them, but they're mostly housed individuals. Redmond, here in Bend, Pine, and there are a few that are in that transition that are at a hotel room, or and then a few that were homeless. But it's not a large majority. They didn't meet what they were expecting in terms of, you know, the majority being homeless. I don't know if that applies to other areas here, but it's a proportion. So of our 23, ballparking it around 6, 8 would be in that on the street in a vehicle homeless situation.
That's really important for public perceptions of addiction. I mean,
Yeah.
you know, there's so many people in our community who think that all the addicts in our community are homeless. And meanwhile, it's like, well, you know, we have maybe 1,500, 2,000 homeless people in our community. We have tens of thousands of people who are struggling with substance use disorders. So
I think the highest proportion, I think the highest proportion of the 23 is private residents. They were homeless.
That is powerful data. I remember in another county, we had a map done of where.
Yeah.
And it protected the data in the sense that people couldn't be identified, but they did a read and broke it down. And it really did kind of get people to think that it's not a this person problem. You know what I mean? Like with their stereotyping. Yeah. It was powerful. So I'd be curious. I mean, with your 23, you're going to get more data eventually.
Yep.
Could you, that would be powerful to have like a map of it or a pie chart or.
We do have a map.
You do have a map.
Yeah.
You have a map.
But it's a point map. You know exactly where they died. It's.
Yeah, that-
Don't share it with anybody.
yeah, that's.
But even just knowing the
Just
break.
breaking it down, you know, there's 3 categories of location where
Yeah,
the person died.
Yeah, you
Give us
can
a
use.
bar chart of that. And
Yeah,
that'd be great.
if you have specific questions, I can do this. So then our numbers are small, but if you have specific questions, please feel free to email me around these issues and I can tell you numbers. And then so part of my responsibility is to protect privacy and anonymity. And so I just have to make that judgment. If there was one individual in Redmond or in this area, I probably would just refer to it generally and wouldn't tell you specifics. But if it's, you know, a large enough number and no one could be identified, it's the primary risk.
What would be really interesting is seeing the rates of prescription of buprenorphine over the last 2 or 3 years compared to the deaths and the drop in overdose, because that may be a reflection of the access to treatment.
Treatment?
yeah.
Which might be easy to extract. I'm not sure, either from, yeah, it depends on how the coding's done, but definitely if you see the majority of buprenorphine is prescribed for medication assisted therapy. That would be one way to tease out maybe one element. Cause I think the access has improved since I've been here. But
Yeah,
still not great.
I agree. I've had that thought before in the
That
past.
would be really cool if we could get.
That would be a treatment data source. That would be another independent data source around active patient prescriptions or looking in the recent past. And that is a data source. I don't have access to it. I don't use it in mine. So it's not something I could do, but it could be done.
Yeah.
Well, since we're.
Yes, we're over time.
I just want, one last plug is that there is an overdose surveillance response and communications email list that's sent out monthly with some mostly real-time data or as close to real time as possible. And if any of you want to be part of that list, it was suggested that maybe I should offer to PHAB to see if some of you would like to receive that.
I'd be interested.
Okay.
Yeah.
All right. Sounds good.
Thanks, everyone.
Thanks, Matt.
I guess we'll adjourn the meeting. Thanks, that was great.
That was great.
Thanks, Matt.
Strategic discussion. Someone.
Well, it felt very strategic.
I want to be an epidemiologist when I grow up.
I wanna put a student on some data. And I want some maps.
I mean, Matt, he does a lot of things, but a lot of times, you know, people ask, hey, could you know what this is and that, you know, he, you know, has a scope that he works into, so. But, yeah.